Welcome back. According to the Centre for Addiction and Mental Health, in any given year, 1 in 5 Canadians experiences a mental health or addiction problem. If you think that statistic is troubling, wait till you hear this one. Suicide is a leading cause of death for both men and women. Why do our communities choose to turn a blind eye to mental health issues? I'm honored to talk to 2 experts who deal with this topic on a regular basis. Dr. Fariha Khan and Yaseen Poonah. Fariha is a family physician based out of Brampton. Yaseen is the co-founder and executive director of Naseeha, the Muslim Youth Helpline. Let's hear what they have to say on the topic of mental health. Fariha, Yaseen, thank you so much for coming on the show.
Thank you for having us.
Thank you.
So we're talking about, what seems to be a very taboo topic, which is, the issue of mental health. So I want to start right with that. Why is the issue of mental health, and I mean, you guys deal with it in your professions, why do you think it's such a taboo topic in the Canadian community as a whole?
I think that, well, first, I guess, it's worthwhile just sort of defining what mental health is. And when I talk to my patients, we sort of say that it's the set of emotions or cognitions, judgment capabilities, thought processes that allow you to function in a productive way in day-to-day life. So I think when people end up struggling with that, there's this fear factor, embarrassment factor, this sense that they failed somehow, and that's not something that people want to admit and broadcast to the world. So I think that's where a lot of the taboo comes from.
And Yaseen, what about like in your work?
I'm finding that the lack of open conversations with the parents, the fact that sometimes culturally in their society it's unacceptable. I'm finding that this is the biggest gap between admitting to it or admitting symptoms with it, and the lack of communication within the professionals or even their teachers or their guidance counselors, or most importantly their parents.
And what kinds of issues? So I know, Yaseen, you deal with the Naseeha, which is a Muslim Youth Helpline. Fariha, you're a family physician. So what kinds of cases do you guys see when it comes to mental health? Because I mean, your definition was great, because I know, to be honest, nobody ever sits down with you and tells you, by the way, this is what mental health is, and these are the symptoms, and this is how you deal with it. So what are some, examples that you guys are dealing with?
I think with what Fariha said, she said it right on, is the fact that, when you feel like you can't do something day to day that will affect your productivity. On our side, I mean, as, primarily the youth, they'll call in, and sometimes they use it as an excuse, unfortunately, but the fact that—
To not do their homework?
Exactly. Like, well, that leads to pressure. And
yes.
I mean, sometimes it's unnecessary pressure, but the fact that, now culturally too, and why I say culturally is based on experience, a lot of things come from expectations with their parents. Okay, no offense here, but you got to be doctors, you got to be engineers,
lawyers.
You got to be lawyers. And unfortunately, the society now, like, even for me, day to day, I'm like, man, like, society is becoming so expensive. If you're not bringing your income the way it should be, like, you don't know what to expect in the forefront, right? So going back, there's that expectation. So sometimes they're dealing with 3 or 4 exams, and right away they're, amongst girls, they're calling in and they're doing self-inflicting pains just because they can't handle things. Or there's relationship issues that they call in. Again, Muslim youth calling in, and sometimes we have the spouses calling in just because there's financial pressure and so forth. And what that does is it escalates. If you don't have that open conversation with either your spouse or your parent, then guess what happens? It happens again, and you can't fix it.
And they're both genders that are calling.
They're both genders, and the age group is quite large, and the fact is, at a certain point, the balloon blows. And sometimes, sometimes when they go see a professional, it might be too late, and it could have been just a little bit more of an ease if they just, first of all, talked about it between, the 2 parties that are involved, or reaching out for help, whether it's their accountant or a call center or a helpline, or most importantly, a professional such as a doctor or a psychiatrist.
So for here, we're going to put you on the spot. As a doctor, what are examples of some of the cases that you're dealing with when it comes to this issue?
I would say, so as a family doctor, I probably see cases of, in particular, depression and anxiety probably every single day in my office. And
every day?
Absolutely, every day, absolutely. And we probably see new cases at least every week or every other week. And not necessarily large overarching diagnoses, but even people who are struggling with a specific challenge, whether it's in the workplace or at home, that is starting to impact their life overall. But we see, I mean, with Naseeha, I guess you're finding that you do see a broader age range than what you are geared towards.
Yeah.
But I see things from literally from young children all the way up until elderly. Like, You know, so young children will often, they won't present as saying I'm depressed or I'm feeling down, but they may present with a pain that's not explainable another way. You'll see youth with some of the issues that we talked about, and then you'll see adults with financial issues, marital stresses, dealing with elderly parents who are unwell, other health problems that lead to depression. And then the elderly, that's a group where it's hugely forgotten because they're dealing with lots of losses and lots of changes in life, changes in their perception and outlook on remaining life. So depression is actually a huge issue in the elderly as well.
And do you guys think, obviously from your conversation, it sounds like depression is very common, correct me if I'm wrong, so that's the impression that I'm getting. To what extent do you think it's become too normal in some ways, if you know what I mean? So in terms of, you know, do you, like how many of the cases are, you know, you can diagnose and say, yes, this person is depressed, they have clinically depressed, you know, they're going through suicide and we need to help them, versus, you know, a case like I'm not making fun of kids who call in and say, I'm depressed because I don't want to do my homework. I'm sure I would have done that when I was younger. But to what extent are you seeing that, you know, it's become commonplace in that sense?
Well, it's a twofold. I mean, in the professional area, not to say that they're doing anything wrong, but it's a cool fad. Like, I mean, Bell has their Let's Talk campaign, and it's working phenomenal. They have like really key celebrities behind there, and it's kind of like a cool thing, a cool hashtag and so forth. And it's probably sometimes the context is taken a little bit differently because it's just so cool and everyone's talking about it and everyone's saying take care of those patients that do have this mental health issues, that sometimes it's a false diagnosis, you know, the fact that, you know what, it's just an easy excuse. Like we see it in courts and trials, the fact that if, you know, somebody is murdered, the fact that it's not enough to be, you know, drunk behind the wheel anymore. It's just they don't feel themselves anymore. They've had pressure, and you know, it's like a little bit more of an easier way out. As far as our calls are concerned, yeah, I mean, there are certain things that, you know what, when somebody called in and they have, for example, a spousal issue, like let's just say financial issue again. I mean, at first it's really cool to kind of say, you know, the fact that they do have a mismanagement control of spending in finances. You know, they like their Burberry handbags, if you will. Yeah. But my budget doesn't really allow that. Accept it for what it is, and we can try to tackle that. But you know, the fact that, you know what, you know, I do all the work and he doesn't, and you know, it's getting me depressed. And the fact that now I want to buy something on my own, and you know, we get into fights, and now it's kind of leading towards, oh, his depression or his way of talking down things to me. And it's kind of like justified that I'm doing something okay, but they're not.
So that makes your jobs a lot more difficult now, because now you're dealing with this. How do you find the balance, right?
Well, I find that oftentimes the challenge is, you know, a patient comes into your office, they have a set of symptoms that they're explaining to you, and so my job is to sort of get the history, get the story, do the appropriate tests or investigations that might point towards another cause, right? That's simply treated and done. But when over time a true diagnosis of a depression and anxiety, and I say those because they're most commonly what we see, it generally will declare itself over time as being a true depression or anxiety, as I'm seeing these patients regularly. But the what you mentioned about it being sort of cool and being a potential excuse, and it's not to discount that there are true diagnoses, but there has to be a balance between what are emotions or thoughts that are a little bit beyond your control, and then what part of it is actually your responsibility and your resilience and your coping skills and your grit. And not to say that those should just come to you naturally, but I think that people do need to develop that as a skill set if it's something that they're lacking in. No differently than we have patients who have cholesterol issues. We say, hey, you need to exercise and watch your diet, right? We don't just sort of throw up our hands and say, woe is me, I had a heart attack because this is what God handed to me. Same thing with depression and anxiety. People may have a predisposition. We know that there are biochemical factors. We know that there's family history involved, and genetic components. But there are ways that people can sort of make appropriate decisions and judgment calls and develop the proper coping skills to help counteract that.
So just picking up on the point you mentioned about coping skills and resiliency, you know, I've had friends who've been diagnosed clinically with depression and, you know, attempted suicide and that kind of thing. And they've been told by their community, by the Muslim community now I'm talking, that, well, you know, it's because you don't, you're not practicing enough. You don't pray 5 times a day, you don't read the Quran, you don't give charity, and this is why God is doing this to you. Like, you just need to pull your act together. So what do you guys, first of all, do you guys see that, and how do you deal with it?
You know, like, for us, I mean, the difference between us and a professional is the fact that, you know, most of the time we're the frontline call centers that they've, you know, as soon as they find that they have an issue, they call us, and we're not that professional to kind of go and diagnose, you know, as a professional or as an imam.
But you do have trained counselors.
Absolutely, we have trained counselors that at time we specify our training just on mental health. But like how Fariha was saying, mental health is so broad that it would probably take you years to kind of specialize in each topic. And what we do at a certain point, we'll go ahead and send that to our professionals amongst the community that they live in to kind of escalate and take it from there. Now, to go back to your question, I mean, you know, there are some truth to it. I mean, you know, whenever we face a calamity, we should always return to our Creator and try to find at peace and trying to find these solutions and that's so forth. You know, whenever we do have a problem, as far as Naseeha is concerned, we always come to the root of what the solution should be and go back to your Creator. Not to solely go back and say that, you know what, it's all in, you know, your prayer and nothing else should be neglected. I mean, you go back to what our prophets and his sayings are, that you should at least tie the camel. You should at least see your professionals. There's so much wisdom behind the knowledge of doctors and psychiatrists and even parents. Open conversation is probably by far one of the most referred diagnosis that as a counselor that we give before giving a professional, because sometimes the root of the problem is inside their four walls, inside their house. Sometimes it's a lack of communication, sometimes praying together. Sometimes, you know, lack of communication is the biggest thing, because when it comes to prayer, I mean, you're talking to your Creator, and if you're lacking communication within your parent, I can only imagine the lack of communication with the Creator. So you need to have that open conversation. But I wouldn't go ahead and say that, you know what, you have to be at the mosque 7 days a week, you have to be like praying from night to day. There's a balance, and our Prophet has mentioned there's a balance between it. In fact, he split his time between three parts: one for his Creator, one for his family, and one for his community. And I think that's that true balance, that we need to have a social aspect where we're amongst the community, Muslim and non-Muslim. We have our parents, we have our siblings, we're not like competing with each other, we're having open conversation, and you're thanking your God. And we always say this, is that when something good happens to you, you thank Him. And when a calamity comes in and you're being tested, I mean, it's always the result that we're being based on. We instill patience, and we ask for our God, our Creator, for a quicker resolution that is beneficial for everyone that's involved in that situation.
And Fariha, as a medical professional, I know you don't just deal with the Muslim community, but do you see these kinds of, I guess, this case? Because obviously people who come to you, you know, come to you for help.
I guess the religion aspect, and I don't mean just from an Islamic perspective, the religious aspect, and interestingly, in many ways, and is almost reflective of society in general, we've moved away from it. Almost there was a time, and maybe we're in a time where it's not sort of appropriate or acceptable to factor religion into a potential solution. But I guess as I move further and further away from my medical training as a medical student, where you did everything very much by the books, and now my practice has sort of been molded by life experiences, I very much with patients, you know, I often go back to basics in terms of treatment for things, and I say, well, whether it's diet, exercise, hobbies, you know, taking time for yourself. And the other aspect that I'll say to people is, well, what do you have a faith background? Like, is that something that's important to you? Is that something you were raised with? Is that something that was important to your family growing up? And very interestingly, because I actually deal with more non-Muslim patients in my practice based on where I work. And I actually find many people will come back and say, yeah, you know what, we used to go to church on Sunday, or that used to be, you know, we used to be very close to a pastor who was a family friend of ours growing up, and they've moved away from that. So as there's the one aspect of it where we say, let's not just chalk it all up to lack of faith or lack of understanding of your faith. So that's not a great way to look at things. But there is also a role to reintroduce it, because I do think that that's something that is lacking in our society in general. Just so for it's not so much that it's the Islamic faith that's lacking in people, but that people had a component of faith that they slipped away from and stepped away from over time. And so it is something that we do find as a very helpful solution sometimes, part of the solution.
And you did mention something before you were talking to me, and you were saying that for you guys it's a little bit more difficult because it's not like you can pull up an X-ray and kind of say you got like a depression issues. I mean, you
It's
got
right there.
Yeah. So for you,
there's no MRI, there's no CT scan, there's no blood work.
it's a background question. It's you know, what's your faith? Has there been something detrimental that happened in your life while growing up? So you have to be a little bit more diligent as far as the questions that you're asking.
So this is a great start to, you know, the solutions discussion, and I'm looking forward to having you guys on next week so we can continue the conversation. So thank you so much.
Wonderful, thank you.
Thanks for having us.
Hey YouTube, we hope you benefited from this video. If you liked it, or if you didn't, let us know in the comments below. And if you're interested in learning more, check out some of our other videos. And don't forget to subscribe so you can get new videos every Monday, Wednesday, and Friday.